All right, everyone. Welcome back to Chiro Shift, the podcast that will change your perspective of the chiropractic profession. Today, we have a little bit of a different episode for you guys. Recently, one of our hosts, Taylor, was on a podcast and discussing chiropractic. And I think through that podcast, a lot of interesting points were made through the comments that we wanted to take the time to address, because I think there are a lot of misconceptions that still exist around our profession from both the public as well as within our own profession. And I think this is a great opportunity for us to begin to talk through some of those points, to create clarity and to really define what our position is on the profession of chiropractic, what it is we're capable of doing, and really put some footnotes into the comments that were made in that podcast. So I want to get started today by saying, and I'll let Taylor chime in here in a second as well, that we both love chiropractic. I want to make that abundantly clear that we are not anti-chiropractic in any form or fashion. That is why we strive to provide information on a daily basis, to create clarity and to give you guys information on how it can be helpful for you. I think at times this comes off as being maybe overly critical of certain aspects that exist within our profession. But again, that's what this episode is for today. So I'm going to let Taylor hop on here for a second and share some of her thoughts, because she was the one that was put in the spotlight in this and faced some harsh criticism. So Taylor, I'll let you jump in here for a second.
Yeah, I'm so grateful we now have this platform to even have this conversation. And yeah, we love chiropractic. That's literally why we created this entire platform. We have a mentorship where we teach chiropractors because we love chiropractic and we believe in it. And we do believe that it can be the top tier treatment for musculoskeletal issues and complaints. And that's really what we want to talk about today. My biggest, before we get into all of it, is just like on a side note, if you're going to comment on social media in general, one, maybe watch the entire episode and not just like a 5-second clip before you judge somebody first. Second, you don't know who you're commenting to. These are real people. Do not say mean, derogatory words on social media just because you don't have to say it to their face. It's not cool. We can do better. And as chiropractors, we need to do better.
And that brings up such a great point, because I think it's very easy to get carried away in the comment sections of social media posts. It seems as though there's not going to be any type of, what's the word I want to look for here? There's not going to be anything that comes back to you from making these types of comments. And I think oftentimes you might think that no one's even reading them. But the reality is that there are people on the other side of things. And as much as I think many people were maybe well-intended in what they wrote, I would say a lot of these things were pretty inflammatory and just not nice at the end of the day. So like I said, we're not here to berate anybody or to make anyone feel bad, but really this is an opportunity for us to just talk through some of those points and really share our side of the argument, and more specifically, Taylor's side of maybe this filtered down version that was eventually posted. So I wanted to start with one comment that was made, and the comment went, "Sorry, girl, this one ain't it." And she sounds like she's talking down on chiropractic care just to promote whatever it is she's trying to sell. So we know that Taylor works with the hypermobile population. She doesn't necessarily see people in person anymore, and that it is different than what most people would view traditional chiropractic care is. I can tell you from knowing her for a few years now and having many conversations with her that, as we already mentioned, she's truly passionate about helping people, and helping people specifically within the hypermobile population. This was not meant to be a sales pitch whatsoever. I think she simply brought up some points that need to be talked about. So Taylor, from your perspective, when you read something like this, what would you say to someone who clearly has this misconstrued perception of what you were trying to do on this platform?
Yeah. And so like David just said, I speak for a population that has unfortunately been really hurt by the entire medical system, the entire healthcare system, but honestly really hurt by chiropractors too. And it is a lack of knowledge on chiropractors. We don't screen for hypermobility, we don't understand what the risks are, and we don't give proper informed consents. I have had so many clients hospitalized from a chiropractor, and we talk and we say that that doesn't happen and that's so rare and that'll never happen. That's not true. That's not true. It does happen. It happens every single day. And those people deserve to be helped too. And just because an adjustment isn't what they need and isn't safe for them doesn't mean that chiropractors can't help them. And that's really what I was trying to get across, is that as chiropractors, we can do so much more than just adjustments. Like so much more. Adjustments are one tiny piece of what we can do. And being virtual has proven that. As far as me selling something, I think it's funny. If anything, I'm just selling self-management and your ability to start taking care of yourself, taking ownership of your own life, building confidence. And if that's my sales pitch, I'm okay with that.
Yeah, and I mean, if we're within this healthcare space and we're truly passionate about people's health, and we look at the things that we know are beneficial for people, especially the populations that we're working with as chiropractors, things like promoting people to be active and take ownership and giving people tools to self-manage is a part of that process. And I think one unfortunate thing about our profession is that it seems as if we have this identity crisis on a regular basis that if we're not adjusting, we are not doing quote unquote chiropractic. That chiropractic is equivalent to adjusting or aligning the spine or whatever language it is that you want to use. The reality is that chiropractic is a profession. There are many things that fall within our scope. And maybe despite where the profession began 130 years ago, we are a profession that is trying to evolve. And I think part of that evolution is really taking into consideration what are best practices today. So I kind of want to dive into this idea of utilizing research within the way that we practice and how important this is, because I know there were several comments on this post that talked about, you, Taylor, not really reading research or being aware of what the research is around the chiropractic profession. For those individuals who seem to think that you're a little bit clueless in that area, can you start to talk about how you go about evaluating research? Because I know, and the audience might not know this, but that you do have a background in research. And what approach do you take when you're evaluating the entire body of evidence that's available to us into your clinical decision-making process when you begin working with patients?
Yeah. So first off, my background is in research. My undergrad degree, I was in an undergraduate research opportunity program. That's what it was called. That's where I learned how to read research. That's how I learned the value of research. It was not in chiro school. And I know for a fact, chiropractors, I'm just going to say it, and I might get canceled for this too, but chiropractors don't know how to read research. They don't. Unless you took something in undergrad, you don't know how to read research. And so when it comes to utilizing research as a part of this clinical picture, it's only one part, but we have to use it. And so I love the evidence-based funnel where it's current research, current evidence at the top, then our clinical experience, patient experiences, and bringing it down. And that top part, the current evidence, has its own pyramid as well. And so when it comes to research, there is a hierarchy. And at the top of that is systematic reviews or meta-analysis, and then randomized control trials, then cohort studies, then case controls, then case series, and then some anecdotal stuff. The evidence out there right now for chiropractic, any systematic review, any meta-analysis, anything at the top that would be considered what we can use as current evidence, states that the subluxation theory is not how the human body works. It's just not.
Yeah, and I think something that we can use to really bolster that statement is this quote from the International Chiropractic Education Collaboration, which consists of chiropractic institutions across the world. I believe it was 14 of them, and I believe almost all of these were outside of the U.S. And they wrote a position statement paper again in 2014 that said the following: and we'll post this in the video so you can get a better view of this. But what they said was the teaching of vertebral subluxation complex as a vitalistic construct that claims that it is the cause of disease is unsupported by evidence. Its inclusion in a modern chiropractic curriculum in anything other than a historical context is therefore inappropriate and unnecessary. So I know subluxation complex is something that the chiropractic profession was kind of built upon. And when you look at the history of our profession, and that it was really the epicenter of everything that we did as it relates to health. I think on the other side of this argument, and I think it's only fair that we talk about this, is that there is research that exists around subluxation complex, and a lot of it is done by Heidi Havoc, who is a PhD and chiropractor. And I think this is something that most people will allude to when they begin to talk about evidence in support of subluxation complex and our role as chiropractors within health. So I want to kind of roll over to another quote here. And again, we'll kind of post this in the video version for you guys who are watching. This was another comment from the clip that Taylor had with Olivia. And the comment was, look, we only know what we know. With that said, I do encourage her, Taylor, to educate herself on the wonderful chiropractic research available at her fingertips. Perhaps she doesn't influence the nervous system with whatever type of application she uses in her office. Totally fine, you do you, but don't speak for the profession. A lot of chiropractors are nervous system based, not just getting rid of aches and pains. There is research, Dr. Heidi Havoc is huge in this area, that validates subluxation theory. So I know we've both read some of Heidi's research, and as you mentioned earlier, that there are things there that suggest that we are doing things that affect the nervous system. But I think my counter to that is that I could pat you on the back. We would probably also see changes in your nervous system. I don't know that any of that research substantiates subluxation theory. I think a lot of it occurs in this world of we're trying to find a result and we're conducting research specifically with that in mind. Coming from a research background, what problems do you see when we begin to conduct research in this way where we're clearly biased towards a certain finding? What issues tend to come up when you do something like that?
Yeah, so there's a couple of things to look at when we are reading a research paper. And the first is the sample size. N equals, that's what you'll see. And if it's only 11 people in the study, just keep that in mind. The other thing to look at is who has funded the study. Why was this funded? Is it funded by somebody that might benefit from that? That's called confirmation bias, and we don't want that. And then we also need to look at how the study was done. I think a lot of people read abstracts and conclusions and forget that the meaty, most important piece is the methods. What did they do in this study? What did they see? What did they find? How did they do it? And in a lot of Heidi Havoc's research, and I've no hate to Heidi Havoc, I think what she's doing is great. And I think that she's trying to create research on these topics that we don't have a lot of research for. We don't. With that being said, just because we have research doesn't mean it's good enough research to say and to justify an entire theory that has honestly been disproven by other studies with much larger sample sizes.
And someone will probably correct me here because I'm not going to say this probably 100% accurately. But I do believe on several occasions that Heidi herself has come out and stated that the entire body of research, which is a lot, again, I'm going to agree with Taylor here, like Heidi is doing really good things overall. I do agree that our profession needs more research. So I do want to give her props for this. But I do believe that she has come out and said that despite the amount of research that she's done, we still can't say with high levels of certainty what the overall effects are of spinal manipulation or quote unquote, adjustments for people. I think one of the bigger issues with a lot of this, and when you look at the research, at least from my perspective, is that when you look at the methods in a lot of these, and when we're trying to evaluate, subluxations and then treating, if these things were in fact there, the process is always, we used a chiropractor to assess appropriate levels for care. And I think we also have research that suggests that this is something that we can't really agree upon always. So if we're using one person to determine a level of care that's necessary, but we can't really agree upon that level, I think that starts to create issues. I also think another issue that Taylor mentioned was that a lot of these studies don't have very many people. And I get it. For research, it's hard. It's hard to have the funding. It's hard to get a bunch of people together to really put together large studies. But I don't think we really have any of those. And then my last and final point that goes into this, despite the fact that we are trying to advance chiropractic research, and again, this is a very noble cause, I think we need to do more work in this area. We cannot neglect all of the other research that exists that talks about musculoskeletal conditions and the things that we're working with on a daily basis. When we get into this echo chamber of, okay, I'm only going to read this research because I like the abstract and it supports what I do, and I've found 20 papers that say adjustments are great. Again, we're not anti-adjustment. Adjustments can be good. But then you choose to ignore all of the other evidence that exists as it relates to the things that we're treating. As Taylor mentioned, this is very much something called confirmation bias, and it's not good.
It's not good.
It's not good. Okay. As healthcare providers and people who have a background in science, because we do, I know what the curriculums are. I know what the prerequisites are. We all have a background in some science. We need to be able to take a step back and consider from a physiological perspective, from a neurophysiological perspective, from an anatomical perspective, from a pain perspective even, what are the things that could potentially be influencing the care that we're providing? And I think this is a great segue into some of the other points that were made on this other post, where that a lot of people have success with chiropractic manipulation, and they go from these places where it very much feels like you're out of place, like you're twisted and turned and your body is just not right. We empathize with that. We've been there. We understand that it can feel like your body is a mess and that it's broken. And that at times by getting adjusted, it can feel like you are put back together. We're not taking that away from you. Your experience is yours. That's an important thing. But I think when you begin to look at what we're actually capable of doing through spinal manipulation and what the effects of that are, I think the narrative is probably a little bit different based on what we know. So Taylor, could you explain to the audience for a second here, when we perform an adjustment, when we manipulate someone and they go from the sensation of, I feel all over the place, I'm not right. And then after the fact, they're like, oh my God, I feel so much better. You saved me. Things are back where they need to be. From your perspective, what is happening when people have those results?
Yeah, I think there's a lot of factors that go into everything in the human body, and especially when it comes to pain. We say this all the time, but pain is always multifactorial, which means our solutions get to be multifactorial as well, which is great. And so going back a little bit to the conversation we were just having, let's say we don't have any research on this topic. Let's just think anatomically. We all dissected cadavers. We did in chiro school. We learned anatomy. We know how much force it would take for you as a human being to move a bone out of one place into another place. And I know we're going to talk more about that. And this whole idea of like nervous system flowing and innate intelligence flowing, where is that in our anatomy? Because I didn't.
And I think it's maybe good to bring this back for a second and maybe think from a historical context what was going on when these ideas were put in place, right? We're very late 1800s, very early 1900s. And I think as a profession, we get a lot of slack for this because there were some interesting ideas that were brought up within the creation of our profession. And that's maybe a story for another time. But, some of the founding ideas were that we want to be able to take a conservative approach to healthcare. Something we agree with today. Absolutely, yes. 100%, right? But the explanations that we were coming up with at the time were very much that our nervous system has this flow, and if that flow is interrupted, we will have disease because our innate ability to heal will be compromised. Okay, so to kind of put some context here, like this is where we were starting from, right? The issues that we both have here are very much that, okay, we're 100 plus years down the road now, and I don't think we've identified that this exists, that if your spine is not having appropriate movement, whatever that means, or that things are maybe twisted or turned in a way that some people would consider are subluxated from a chiropractic perspective, that decreases nerve flow. I think the other side to this, and maybe why we get so stuck in this argument, is that when we adjust people, we see amplified nerve signals in the brain often. And I think this is a lot of what Heidi's research talks about, because she's very big into the neurology of things. So it's maybe fair, if we look at it from just that perspective, that, okay, if we see increased signaling following an adjustment, it must mean that we had decreased signaling. But that's not how science works, unfortunately. You don't get to just say the opposite is true because we see one thing, right?
And just
Go
to be
ahead.
clear, you would see an increase in your brain activity, like you said before, with a pat on the back, with a hug, with anybody touching you, you get increased brain activity. That's a
Yes.
really cool, powerful thing about human touch, which, going back to the original question up front, is part of why after an adjustment, you do feel a lot better and you do feel good because you are with somebody that cares about you. That helps you feel better. Somebody is telling you, hey, I'm going to make you feel better, and you trust them. And they're a person of power in this situation as well. They are showing you and telling you, this is what's wrong. I'm the person that can fix you. And then I do it. And I'm telling you, wow, that's so much better. How many times have you heard your chiropractor adjust your back and be like, oh my God, that's so much better. Your legs are so much more even. Of course you're going to think that. Of course you're going to feel that. So yeah.
No, I mean, that's a really important thing to acknowledge. And again, we will emphasize this continuously as we continue to make this podcast, is that there can be a lot of benefits to spinal manipulation and adjustments. They will often make you feel good. I know a point you made in the podcast was it temporarily increases range of motion. And you got a lot of flack for this, because I think everyone immediately goes to, it's not just about range of motion. It's not just about pain. It's about nervous system regulation. And I think somebody brought up the term salutogenesis, which we'll talk about that in a second, because I don't think the context that they used it in was necessarily the best. But there are effects that tend to be transient through spinal manipulation that can be very, very helpful for people, and the interaction with the healthcare provider who cares about you, because we do believe that many, many chiropractors care about their patients, can be helpful as well. But I think the angle that we're coming at this through is very much that we can't look at an adjustment in isolation, because it's not happening in isolation, even if that's the only treatment provided, because you need to consider the contextual factors of that visit, which very much include how you feel about the provider, how you feel about the environment that you're in, what your mood is like that day. Do you believe in the care? We could go on and on with what this list is. But even if the only treatment that was provided was the adjustment, these other things are still all at play. And that's part of our biggest point, is that even if people get results through spinal manipulation alone, as much as we're movement biased, we do agree people get a lot of benefit from adjustments alone. Maybe it's not always for the reasons that we think, or the things that seem to be the most obvious. So I want to transition to this idea of salutogenesis. And to be open and honest with people, I did have to look this up, what it meant. But the definition that I found was that salutogenesis is an approach that focuses on promoting well-being by emphasizing the ideal state of health. So I think from a chiropractic standpoint, philosophical chiropractic standpoint, it makes sense. We need an aligned spine to be in an ideal state of health. We need maximum nervous system flow. You need to turn the light on. You need to put the paperclip back together, whatever analogy you want to use, right? I think that we know, and if we take a step back, probably most people would agree with us here, that an ideal state of health goes so far beyond any modality that we could provide a patient. We cannot ever come back to this idea that chiropractic care, and specifically spinal manipulation, is going to be the thing that supports salutogenesis for a person. And I believe the quote was, for a lot of chiros, we focus on salutogenesis. How can we better support the body to function optimally? Well, I agree. There are a lot of things we can do to support people to function optimally, but I don't know that that answer is spinal manipulation alone. So based on that comment, Taylor, maybe let's talk about some positive things here for a second. What are some of the things that as chiropractors that fall within our scope we can do to support a more salutogenic environment for our patients to be in a more ideal state of health?
Yeah, I think this is literally my favorite part of being a chiropractor, and why I love chiropractic so much is because we have the widest scope when it comes to musculoskeletal health. We can promote exercise, we can promote lifestyle changes, we can promote behavioral changes, we can create confidence in people, we can make people be able to believe in themselves again and be able to, like, self-efficacy, believe in their ability to do things again. That's getting your power back. That's how you build overall health. And if there's pain involved, we can help mitigate pain, especially acute pain, in a safe way that, for if all red flags are ruled out and you don't have a condition like a connective tissue disorder, adjustments can be, and as well as like soft tissue work. And there's so many other things when it comes to passive modalities that can allow us to have a short-term pain relief without having to take drugs, without having to have surgery. That's so valuable. And for people who have been in pain and now they're finally out of pain and they can do more, that's huge. That's how they start their overall health journey. But when it comes to overall health, I can't get behind the idea that getting adjusted is a part of that necessary picture. That's the biggest issue I have, is that we need to get adjusted to have salutogenesis, I guess. And I've seen this be compared to dentists a lot, and I have a big problem with that. There's a big difference between getting your teeth cleaned and making sure there's no bacteria in your mouth than getting your spine adjusted. Those are not the same. We cannot compare those.
And I think a lot of this falls back to the idea that only chiropractors are capable of accurately assessing spinal health, and that we're the only people, or at least the most qualified people, to ensure that it is quote unquote functioning the way that it quote unquote is supposed to. Right?
Yeah.
I think there's a lot of assumptions being made when we begin to go down these conversations, and I think this makes it challenging for patients in the sense that I can very much understand that if your back hurts and someone tells you that a bone's out of place or you don't have good enough movement in an area, and that they then adjust you and that you then feel better, this entire story, it just makes sense.
Yeah.
I mean, why wouldn't that? It's a very simple explanation. It's very easy to understand, and the results from spinal manipulation, what we tend to feel, makes sense.
Yeah.
From a very baseline level, this is something that I think why it's so easy to accept subluxation theory, especially as a patient. But I think the challenges that I always present are that, well, if it takes someone providing mild to moderate force, and then that's what puts something back in place, and we look at the demands of daily life, or especially the demands of certain sports, I hate to kind of get off into these like comparisons sometimes, but I think this might kind of frame it for some people that are not quite as, aware of what's happening with our spinal health. If you look at violent sports like MMA or football or rugby or hockey, and the hits that people take and the impacts that occur, if we're able to put something in place and be specific about it by, giving a little one of these guys to the mid back or a little rotation to the neck or whatever it is, how could those hits that are exponentially more forceful not just completely put your entire spine out of position if that were a thing? And how would you not need to be adjusted after every single play that you run? Again, like I hate coming back to these analogies because where there's not a lot of science necessarily rooted in these points that I'm trying to make. But I think just from an overarching standpoint, we can kind of paint a picture with it. And if it's that easy for us to put something back in place, and it's that easy for you because you sat at your desk all day and didn't move enough for things to go out of place, how are these athletes even alive? How is their nervous system functioning at all? It's like, to me, that doesn't make sense. So again, this is kind of just a narrative to paint a picture, and I don't want to get too much into details of that, but just something to think about from that perspective. And I think one thing, and I hate kind of pulling up all these comments, but I think we're doing so because they make very good points for conversation here. This one that really caught my eye, and I know it caught your eye as well, Taylor, was that someone wrote that it only takes 2 weeks for a dysfunctional or chiropractic subluxation to start the degenerative process, which leads to arthritis in that joint. That is why ongoing long-term chiropractic is beneficial for prevention. So very much along this idea that you need to see a chiropractor regularly like a dentist, right? Let alone the neurological effects that could occur by not getting the subluxation corrected. PT and other providers are great, but chiropractor is different. I disagree with this statement that subluxation theory is false and that it has nothing to do with moving bones. So there's a lot to unpackage here with this idea. And honestly, like, I don't know where these numbers come from. I've heard 2 weeks before from multiple people, and maybe someone can enlighten us in the comments, right? But
Yeah, let us.
like from your perspective, when you read something like this, what are you thinking? Because I know what I'm thinking. I want to know what you're thinking when you read something like this.
I mean, the first thing I did was laugh. I'm not going to lie. But honestly, and I wasn't even going to bring this up, this brought me back to my old job. And so, for those that don't know, I worked at a chiro clinic that was a chirobiophysics clinic. And this is what they told patients. They had pictures everywhere, and they would explain to the patients that you see those little dots on your x-ray, that means that you have an 80-year-old spine, which, like, you can't even tell that from an x-ray, but that's besides the point. And my biggest issue with this too is going back to this idea that our job is to create overall health and well-being in patients. When you start telling patients there's so much wrong with them and you're the only person that can fix them, that brings on dependence, which is not a healthy thing to have. And then what if they don't get better? Now you're shaming them. They didn't do enough. They didn't come enough. They didn't get adjusted enough. They didn't hold their adjustment correctly. That's not overall health. That's not overall well-being. Are we really doing what we think we're doing? But regardless, as far as what I think about that specific comment, especially about the subluxations causing degenerative changes in arthritis, one, degenerative changes in arthritis are just a natural part of being a human being. Every single human being listening to this will have degenerative changes and arthritis somewhere in their spine at some point in their life. I hope you get to the age where you can have that. With that being said, there is nothing in this world that confirms a subluxation in your spine makes you more predispositioned to this. And also, it's not necessarily a bad thing. It's just part of life.
Yeah. To be very clear, we're talking about osteoarthritis here and not other more pathologic arthritic conditions, because those do exist. Okay. Osteoarthritis is something that nearly everybody will develop throughout their lives. And we very much like to relate it to other normal aging processes like your hair turning gray or potentially falling out. Some of these things just happen. I think degenerative disc disease is another one we talk about. We label it a disease. Your discs, just as you get older, it's very natural for them to shrink a little bit. Okay, this is not a disease. It's part of an aging process, despite the fact that some people might make you think otherwise. So this idea that it takes 2 weeks for a subluxation to create degenerative changes if you don't get it corrected, I can't get on board with that in any capacity. If this were true, I mean, every child in the world who hasn't been to a chiropractor yet would have degenerative changes by age 2 weeks. I mean, I don't understand the statement, right? So these things come out there, and I think our point in bringing this one up specifically was that things like this tend to be a really good way to convince you that you need care on a regular basis. And this is not to say that at times it might be beneficial for you to see your chiropractor on a regular basis, especially when you're new to care or you have acute pain or you have chronic pain and you're beginning a new plan of care. There are very much times where meeting with the practitioner more frequently can be beneficial for you. But if someone is saying that this is something that you need always for the rest of your life, or else something will happen that is not good, we cannot sign off on that in any capacity whatsoever. So
Yeah,
this is
and
one.
going back to the beginning, talk about selling something. That's how you sell. That's how you have a multi-million dollar practice. And I'm just going to call them out. Those chiropractic mills that do this day in and day out. This is what they teach their chiropractors. This is how they teach their chiropractors. And I know from personal experience, and it needs to stop.
Yeah, it's scary to me because we're in a field where we're dealing with people that are vulnerable. We're dealing with people that are desperate for help. And often we are selling them something that is not a high value product or form of healthcare at the end of the day. And this is not to say that everyone that treats in this manner has ill intentions. Again, as we mentioned earlier, we believe that so many of you are truly passionate about providing care for your patients. I want to make that abundantly clear that we do believe that. But unfortunately, there are some businesses and there are some practitioners that probably emphasize business more than healthcare, unfortunately. And that's just something that people just need to be aware of. And
Yeah.
again, we'll probably take flack for this, but it just needs to be said. One point that we did want to make today, and for those of you that aren't familiar, our profession was founded by a man, David Palmer. This was way back in the 1800s. And I think when we look at people that talk about chiropractic and what it should be, what it shouldn't be, we often go back to, what David Palmer and then his son BJ Palmer had said. And I think something that's very interesting to me, and this is a quote that I like to hold on to because to me it speaks to some of the message that has been lost from the earlier days of chiropractic, is that David Palmer was very much a proponent for change over time. And I want to read this quote to you guys from David Palmer. Two classes of chiropractors: those who desire to know all they can of physiology, pathology, neurology, and anatomy, and those who have an aversion for intelligence, do not want to take effect into consideration, and depending only upon an examination of the spinous process. So to me, this is an incredibly, forward-thinking statement from someone that, for me, prior to reading this quote from him, would have never thought that somebody in this period of time in healthcare, and especially from the founder of our profession, would have said. But even then, he was dividing the chiropractic profession into these two camps that kind of exist today. And it's those who desire to learn outside of quote unquote chiropractic scope, things like the pain science, the neurology, the physiology, at levels and through lenses that are not simply chiropractic. And then those who really emphasize and maybe solely focus on subluxation. And again, this is his words, not mine. Those who have an aversion for intelligence and do not want to take effect into consideration, depending upon only examination of the spinous process. His words, not mine. But we just want to put that out there. So it's so interesting to me when we look at chiropractic through historical context, because I think a lot of it lends itself to us just not changing over a long period of time. But then we read something like this, and I think it really should create inspiration in those of us today that maybe are on the edge and trying to think about things a little bit differently and maybe wanting to move on from these older thought processes. For you, Taylor, like, what do you think as chiropractors, as younger chiropractors, what should people be doing to truly challenge themselves so that they can be the best healthcare provider within our specific scope of practice?
Yeah, I think the biggest thing that we can do is read research and read it a lot and understand it and read both sides. We've been reading a lot of Heidi Havoc's research recently. Also, networking with other professionals and other medical professionals, MDs, DOs, PTs. For whatever reason, a lot of the time, chiropractors will say, don't go to your MD, or they don't like to talk and have a real I can't pronounce that word, interdisciplinary care team. um, and that's a problem. Patients need that, especially patients with chronic illnesses. They need that. We need to be on the same page. And one thing we didn't really mention is this whole idea of a subluxation is really confusing for the entire medical community, because there is something called a medical subluxation that is very real, that me, myself, and all of my clients unfortunately experience quite frequently. It is when your joint partially comes out of its socket and comes back in. That is the definition of a true medical subluxation, which is very, very real. And when we start using that word as a chiropractor, and I get this from clients all the time, a chiropractor told me my spine was subluxed. Is my spine dislocated? Like, is it out? Is it falling out? That's scary. That's a problem. And then you go to a medical doctor and you say that, and the medical doctor says, don't go to that chiropractor again. There's probably a reason for that, because we're confusing patients and we're confusing each other. With that being said, we need to start having these conversations more. And we need to also, schools as a younger chiropractor, and there was a comment on the thing like, when did you go to school? I am a young chiropractor, and I think that's beneficial because I can bring the most up-to-date curriculum that we're currently experiencing. And my school did not teach us subluxation theory. It did not use that word. It's also not on boards anymore. There's probably a reason for that. With that being said, we need to do more than just what we do in school, unfortunately. School is still not up to par with where it needs to be at when it comes to teaching us everything we need to know. And the biggest thing is communicating and the narrative that you're telling your patient what you're doing, why you're doing it, and how you're doing it.
And it's interesting to me that, to bring back a point you just made there, that things like the national board here in the US have abandoned the usage of subluxation, and that as far back as 2014, an international coalition of schools decided to abandon its usage other than within historical context. And I think I don't want to postulate the reasons why that in the US we're so resistant to change. Maybe it's because we began the profession here and we're holding on to bits. Who really knows why this is? I'm sure there's political reasons behind this, but to me, it's very much an indicator that as a profession, at least on the worldwide level, we are very much trying to move into a more modern approach, which we have failed to do pretty miserably for about 130 years now. And to emphasize another point that you made, I think this is good because we can begin to have interdisciplinary work with other healthcare professionals, and that we don't need to be siloed away. I think for a long time we took pride in being siloed. It's like, oh, we're the conservative people. We're doing care because everybody else is doing a terrible job. And that's a conversation for another day. Like, there are a lot of downfalls to healthcare right now, but something that we always say here is that you need to judge the professional, not the profession. There are bad healthcare providers in every single profession that exists, but there are also a lot of great ones. And when healthcare professionals collaborate with one another, the patient wins.
Yeah.
Every time. And I think that's something that we should not be taking pride in, is that, oh, we can do it all ourselves because we do this and we do that. And no, to me, like, that's being incredibly selfish in the way that we're approaching care. And this is not about us. It really
Let go of
isn't.
your ego. Let go of your ego. Your patients are hurting from it.
Yeah. We can very much be in collaborative relationships with other providers so that our patients can reap the benefits and get the healthcare that they deserve in a system that is, at least in this country, pretty broken right now.
Yeah.
So I think these ideas that, medical doctors are evil just because we're chiropractors and they do too much surgery and they do prescribe too many medications, are these statements true at times? Absolutely. But I also know a lot of young providers that are in the medical doctor space, and they are anti-surgery. They understand that conservative care is a better approach a lot of the time, and they're probably looking for people to collaborate with.
Yeah.
And that could be you as the provider. So I think when we separate ourselves and we stand in our own circle and we pat ourselves on the back, it's not helping anybody. It's not helping our profession. It's not helping our patients. And it's not allowing our profession to move forward like every other healthcare profession is. And again, that's part of the aim of what we're doing with this podcast and what we're doing with the other platforms that we're operating, is very much trying to create a space so that this profession can move forward. And I want to bring it back to the research here for one point, because I know we had a few more things to talk about. And the one quote that I wanted to share with you guys here was something that Dr. Danielle Bellardo posted the other day, and let me find it. God, where'd it go?
Somewhere. I think it's
there it is. Okay. we understand evidence is not the only tool we will use in our clinical decision-making process. We are going to make that clear again. We are pro-evidence because it should support decision-making, and it's a tool that we should be using in the way that we approach care because it's there and it's there for a reason. This quote from, again, Dr. Danielle Belardo said that scientific evidence is not meant to be taken personally. It's not meant to hurt your feelings. It's not meant to judge your character. Scientific evidence serves to either support or counter a hypothesis and be critically evaluated in a systematic way using consistent logic. So I think to wrap things up today, because we do want to emphasize the importance of research, is that, again, we are very aware that there is research that exists within the chiropractic space, a lot of it done by Heidi Havoc, but there's also a lot of research out there that exists elsewhere. And when you choose to only look at certain things to support your decision-making process, you are not doing your job. You're not, okay? There's just too much available to us today that is free access. And is it anybody's favorite thing to do? I mean, I like reading research, but I'm kind of weird, so maybe we should use me as an example. But I think as healthcare professionals, we do have a responsibility to continuously update our approach and our practices based on new information that's available to us. So when you read something and you choose to discard it simply because you do not like it, you're doing a disservice. What thoughts do you have on that quote, Taylor?
Yeah, it's one of my favorite quotes. I love it. I think it's a perfect example of the dichotomy that we're living in currently. We can't take this stuff personally. The research is what the research is. And again, it's not everything. It's not the only thing we take into consideration, but it's that top of funnel. It's the top of the funnel when we look at what a healthcare professional should be doing. And so one of my favorite comments was, "This feels like she never read a single green book. The core of chiropractic is about allowing the nervous system to function as it was intended, and Nate does the healing." And you are correct. I have never read a single green book, and that is because my school and a lot of chiropractic schools no longer use those because they are invalidated at this point. And so that, don't take that personally. That is how research works.
Yes. Maybe good from a historical context, good to see where we've been, should be good to see how far we've come. But I also went to a school where we didn't read the green books. Does that make us less of a chiropractor because they were not emphasized in our curriculum? Or does that mean that, we're really just paying attention to the things that we know to the greatest degree are important today? So would it be interesting to peruse through them and see what we were really thinking 100 years ago? Yeah, I think that's great, because I think it can show change and it can show evolution, and we can look back and see the growth that has occurred, because there should be more at this point. But as that other position statement stated, subluxation theory, things like the green books, they should be used within historical context. And that's about it, because we have so much better information available to us today. So this idea that you are less of a chiropractor, or that you're not a chiropractor because you are not reading these books, you're almost falling into these belief systems rather than being more pragmatic in your approaches. And as healthcare providers within this space, I think, again, we have these responsibilities to be pragmatic in our approaches, and to consider all things, and to consider that we could be wrong, and to consider that we should probably be growing. So when you rely on texts from, 50, 70, 100 years ago, I know they were written over a period of time, and you only rely on those texts, I think there's a problem with that.
Yeah, 100%. And like David said, we love being wrong. We admit when we're wrong. We talk about it all the time. That is part of being a doctor, being in healthcare, being in science. You're going to be wrong. That's the point. We're supposed to evolve. We're supposed to learn more. Your opinion should change. If your opinion hasn't changed at all since the first time you read those green books, that's a problem. You got some reading to do.
Yeah. I mean, literally, if you look at, most scientific discoveries over a period of time, it's because somebody was wrong, or somebody thought outside the box, somebody thought differently, and it led to something great. And that's not always the case. But again, as Taylor mentioned, that's really how science tends to work at the end of the day is we get curious and then we investigate it. And then we learn something we didn't know previously that allows us to grow over a period of time. And that's something that we really should take to heart as a profession. So to wrap up today, I'm sure there will be comments on this as well. And I know that we are very much biased in the way that we approach things, but also, as Taylor mentioned, we're very open to being wrong. So if anyone would like to ever at any point in time come on this podcast and defend subluxation theory and present the research and show us how we're interpreting wrongly, we are open to that. I'd love to have that conversation because, again, we understand that we have biases. Everybody does to some degree, and that's not a bad thing. What's a bad thing is if you have those biases and to no end, you don't live outside of them, you don't consider other things, and you're not open to the idea that you could potentially be even 1% wrong. And I think as healthcare professionals, that's something that we should really we should really have present within us is that we are confident in the way that we approach things and that we've built that confidence because we have a strong base of knowledge in the way that we approach things, but also be open to this idea that at any given point in time, something could show up that says, you know what, you're wrong, or maybe you could do things better, or maybe you should change. That's what this is all about, and this is how we grow. So I'm going to leave it with that for today. Again, that invitation is open to anybody at any point in time. Feel free to comment or shoot us a message. We would be happy to schedule a time to have that conversation because, again, if you can prove us wrong, I'm all for that. I truly am. I know Taylor is the same. This is ultimately about improving our skill sets for our patients. Bottom line. So if you can show us otherwise why we should be adjusting every 2 weeks for every single person in the world, I would love to hear that argument. So until next time, guys, we appreciate your time. We appreciate you listening. We will see you then. Okay, Taylor, one statement that you made in Olivia's podcast was that we do not move bones. And as you talked about earlier, like this clip was cut in a way that didn't provide a lot of context to what you were talking about within this entire conversation, right? So I want to give you this opportunity to create some clarity around what you meant when you said we do not move bones, because I know a lot of people took this very literally. I know that you know that bones can move. Something like if you push on someone's back, the bone is moving. We get that. We understand that. We're not saying they never move. But why don't you provide a little more context to what you meant when you made that particular statement?
Yes. So yes, we do move bones. Our bones move every time we move. Now, with that being said, what I meant was we do not move a bone that is quote unquote out of alignment back into alignment or out of a place back into a place. It takes, and this is what I was trying to say, it takes an immeasurable amount of force to get a joint that is truly out or a bone truly out back in. That is why when you have a shoulder dislocation, which is something that a lot of people with hypermobility unfortunately experience, I've experienced it too many times myself, and you go to the ER and they relocate it. Do you know how much force they're putting in? It's a completely different thing than your little high velocity, low amplitude thrust there. It's just not possible. It's not possible to move a bone that much out of a place back into a place with an HVLA thrust. It's just not.
Yeah, and I think, you know, I like the example that you used there because I think shoulder is one thing. I think another thing that goes even beyond that is if a hip is actually dislocated, and like doctors are standing on the table and they're using their body weight and maybe they can get it back into place, right? So I know the flip side of this argument is going to be, well, the spine doesn't move out of place that much, and we're just making these micro movements to the spine, and um, I want to know from somebody, from any chiropractor that is out there, have you ever seen an aligned spine? Like, have you
I
ever
would love
just
to hear
seen a spine that was perfect? I mean, like, I just don't think this exists. And if that is the case, why are we chasing something that's not achievable? I mean, these are the questions that come to my mind when we start to look at these models. Okay, like, if this were even a thing, Have we ever seen it? My guess is going to be no, because the way that our bodies adapt to movement and the demands of life, it is asymmetric in nature. Even the way that our organs are placed, you split your face in half, you look at your two ears. Again, demands of life. We have dominant sides, and unfortunately, muscles will kind of dictate some of our resting positions sometimes in our body. So, is it even beneficial to be symmetrical and aligned, or is it more beneficial that our bodies adapt to the demands that we place on it every day so that these asymmetries do exist because they're actually beneficial for the demands that we've placed on them, or the sport that you play, or what your job is? I just want to know. Someone, please show me a perfectly aligned spine that was created through chiropractic care. I would like to see that if it exists somewhere.
And I would like to know if more than one chiropractor would even agree on the same one, because we got lots of studies showing that we don't agree very much when we palpate. As chiropractors, we do not have good interreliability at all. We can't. What that means is, like, one chiropractor that's feeling for subluxations will say you have it at one area, and then another chiropractor will come and will say it's at a completely different area. Why do you think that is? Kind of weird.
And this goes back to the idea of the research paper that we talked about, where we can't have one chiropractor assess levels that need to be adjusted and that are indicated if there's no agreement on what that level is. To me, everything after the fact then from that point is not really valid from a research perspective, because we haven't even really agreed upon a site of treatment that needs to be treated. So these are some thoughts to have, or some thoughts that we have when it comes to these ideas and why we ask questions. And I think this is something that's important for every healthcare provider, is that if something doesn't make sense, it's okay to ask questions, and then to learn about those things, and to read the research, and maybe find things that agree with you, but maybe find things that disagree with you. And that's part of this growth model that allows you to be better over a period of time. So we wanted to clip this in there, because I think this bone out of place idea was taken way out of context, and definitely something that needed to be addressed, because some of you just took this way too literal, and that's definitely not the point that Taylor was trying to make.
Yeah, and again, like, maybe watch the whole podcast clip and not just a second social media post, but what do I know?
I mean, it's hard to pay attention for more than like 15 seconds, right? 15, 30, maybe a little bit more.
Yeah,
Be good.
yeah.